Hello again, everyone. It's that time on a Thursday evening when we all get together to hear about something interesting and new, happy in the knowledge that someone somewhere has done something to ensure that what we're hearing has a sound factual basis and it also is evidence-based. Yes, we're Skeptics in the pub online. You can also go to one of the many in-person events coming back to life all over the country. Do check out your local venue. I was thrilled to meet someone at our last meeting in Winchester who'd found us first online, so hello if you're out there watching. Some housekeeping first. Our speaker will talk for about 45 minutes or so, then we'll have a refreshment break before meeting up for a Q&A. If you want to ask a question, go along to Slido. That's sitp.online/ask. Our mods will be putting links to that in the chat. You can also go there to upvote anything you like, any questions you want to hear the answer to. It's a semi-democratic process. Other links will also be appearing in the chat, such as where to buy our super trendy merch. That's sitp.online/merch. We usually have a lively and relevant chat going on during the talk. Please remember to be polite and respectful to everyone, whether you agree with them or not, and not say anything which would upset your great Aunt Mabel over the dinner table. But before we move on to the main event, I've got another announcement to make. I'm sure you've all heard about the devastating consequences of the earthquake in southern Turkey, which has also affected northern Syria, and, like us, have wondered about the best way to help. We're fortunate that one of our Skeptics in the Pub organisers is from Turkey, and he's been able to advise us on the best way to do this. We've been advised of two worthwhile relief funds. One is the Kahramanmaraş Earthquake Emergency Relief Fund through Just Giving. Kahramanmaraş is the epicentre of the earthquake in Turkey and includes the worst hit city of Gaziantep. The other is the MSF Earthquake Emergency, that's Médecins Sans Frontières, who are active in Aleppo, the worst hit city in Syria. We'll be putting these links into the chat, but we'll also be donating ourselves, matching the donations. If you use our usual donation link, sitp.online/donate, anything arriving there over the next 4 days will be split equally between those two charities. And now, I'm really pleased to be able to introduce tonight's speaker, Jack Lawrence. His day job is research into pancreatic cancer, but he's here tonight to talk about his sleuthing into Ivermectin, the antiparasitic drug which was, at one stage, lauded as a cure for COVID. What's seriously impressive is that he was still an undergraduate, preparing for his master's year, when he was looking at papers on the subject and became deeply suspicious about them. That led on to the subject of tonight's talk, exactly what he uncovered. Ivermectin is made by Merck, and Jack wonders if they might think he has it in for them, as he's also looked critically at their antiviral drug, molnupiravir. As if to show it's not personal, however, he's used Ivermectin in his pancreatic cancer research. It kills the cancer cells in vitro, so whether or not it might make a useful therapeutic agent is, he thinks, a question worth asking. But before I hand over to the man himself, I'll mention that he has a further string to his bow: his work on research integrity and research transparency. It'll be clear to all of you why this is dear to his heart. So please put your virtual hands together for tonight's super sleuth researcher, Jack Lawrence.
Thank you very much for the introduction. And yes, today I'm going to talk to you about how I accidentally became a scientific data sleuth. A little bit about me before I begin. As Cleo rightly said, I work on researching pancreatic cancer. In fact, that's me in that second picture right at the far tissue culture hood. And I research, again, as a result of what I discovered, or the rabbit hole I fell down, ivermectin's effect on pancreatic cancer. It is obviously far too early to say whether it does have any effect in patients. It kills cells, but so do a lot of things. So that's just to say that I've got nothing against ivermectin in general. I might say some things today which are slightly critical of the drug or of people who've been promoting the drug, but I do want to say it isn't a genuinely excellent drug, and its past history and potential future are amazing. So during COVID, or since COVID, I should say, if I mention the word ivermectin, what's the first thing that comes to mind? Well, for some people, it will be horse dewormer, or it will be, maybe on the other side of the spectrum, it will be wonder drug, or as some of my friends recently at a party put it, a horse tranquilizer. Now, ivermectin has been used as a horse dewormer. To my knowledge, it's never been used as a horse tranquilizer. But suffice it to say, I think its reputation has been slightly sullied during the pandemic among some, while with others, it has been shot into the stratosphere in a way that I think is unhelpful to debate. If we just examine some of the headlines over the past few years and perhaps some of the tweets, we see on one side that ivermectin is safe, it's effective, it's an amazing drug, it's overwhelmingly positive, we should immediately be investing in it, we should be giving it to every COVID patient under the sun. In fact, we should be giving it to other patients as well, potentially cancer patients. Meanwhile, on the other side, you see stories about drug overdoses or fears of overdoses, of people calling poison control lines. You see articles about horse owners facing ivermectin shortages. You see people calling it unproven, dangerous, and selling fast. You see millions, hundreds of millions being spent by insurance companies on reimbursing ivermectin prescriptions, I should say. And of course, there's a now famous tweet by the US FDA who tweeted, "You are not a horse, you are not a cow. Seriously, y'all, stop it," about ivermectin and people's promotion of it during the COVID-19 pandemic. Ultimately, I actually think, although this tweet is rather amusing, I do think it also has, unfortunately, clouded the debate somewhat. But before I get into that debate, I think it's also fair to address a couple points that of people who promote ivermectin often bring up, and that is that it was that the creators of ivermectin were awarded the 2015 Nobel Prize for its use in humans. You see here some conservative figures who all make this point, and that is true. These people have rightly said it was the discoverers of ivermectin who were awarded the prize, and here you see two of them, Satoshi Omura and William C. Campbell from Merck. And these two brilliant scientists were awarded the prize, but it was for ivermectin's use in animals and in people against parasite diseases, not for its work in ivermectin. I think just because a drug, or a person, I should say, because it's not the drug that was awarded the prize, it was the people, just because people have worked on a drug in one sphere doesn't mean that can be generalized to another sphere. But again, a lot of you might think, well, you might have a vague idea, well, it's maybe works on parasites, a horse dewormer. But let me just tell you a little bit about what ivermectin actually is, so you can understand why it became such a big issue during COVID. Well, it's, as I said, a brilliant parasite drug. It treats lots of diseases, but one of these is river blindness, which is a horrific disease where parasitic worms sort of are laid in people by flies, and it leads to blindness, and it's a really horrendous disease and affected hundreds of millions of people. But ivermectin is able to cure this. It works by various ways, but one of them is by paralyzing the parasite, and then the parasite can be expelled. And also some studies in the past have detected potential antiviral effects. So it really does seem to be that there might be some reason to think it might have some antiviral effect. Well, how is it actually found? Well, the story is quite interesting. Dr. Omura, he would always walk around his local area with little bags, little plastic bags, and into which he had put interesting soil samples. So if he saw some soil somewhere, he'd put that in the bag, take it to the lab, and see what happened. And one day he was walking past a golf course, and he noticed something interesting in the soil. Sort of picked it up, put it in his bag, and then took it to the lab. And initial experiments showed that whatever this substance was having some interesting effects. And that substance that he had found was a substance called ivermectin, was produced by a bacteria. And then after a little bit of tinkering with this substance, they added a little bit of extra hydrogen, and it was called ivermectin. It was first going to be called Ivermectin with an H-Y, until they realized that in some languages, apparently that either sounds close to or sounds like the word testicles. And they thought, no, we can't go with that. We're going to call it ivermectin instead. And then the experimental process really began in earnest. They first put it in mice food and fed it to mice, and noticed that those mice would be cured of internal parasitic infections. And these fairly simple experiments were described by, again, one of the other discoverers of ivermectin as complexity built on simplicity. Very simple experiments showed that there's real potential for the drug. Well, what happened next? Well, the drug was offered into veterinary medicine, where it's had a tremendous effect in horses and cows and sheep, in a whole myriad of different diseases. That was, again, in the around the mid-70s. Then in the late 80s, it was discovered and approved for use in humans, where it, again, has had miraculous effects to many people. And in fact, there are treatment programs for ivermectin, for river blindness, all over, particularly sub-Saharan Africa. And Merck, the the original manufacturer of ivermectin, they made a commitment in 1987. That commitment was they will give as much of the drug as needed for as long as needed to help treat river blindness and eventually some other conditions as well. And 35 years later, they've given more than 4.4 billion cumulative treatments, and they've given donations to 49 countries, all free of charge. And again, I don't think it's unfair to call ivermectin a wonder drug in this sort of sphere of antiparasitic medicine. Well, then a few years down the line, COVID-19 hits. And I think we may remember those early days where there was complete fear. This was obviously before vaccines, before we had discovered some of these new treatments. And so people were looking for anything. They were desperate, and slowly treatment started trickling in, but slowly wasn't good enough. So some people started going through molecular libraries and saying, well, what could work? Let's just test, let's just throw these things at cells and see what happens. And of course, again, the benefits of ivermectin, if it were successful, would be that it's cheap, it costs a few cents to manufacture, it's widely available, you can get it all over the world, and it's relatively safe, actually. Obviously not totally safe, and obviously just because it's safe doesn't mean you should take it if it's not approved, but for standard doses it's safe. So there were some initial signs of hope. There was a study that was conducted in Australia just days after the pandemic had been declared, or at least submitted to a journal, days after the pandemic had been declared. And they had taken kidney cells from it's called a green monkey. They put those cells into, let's say, a Petri dish, and then they had infected those cells with a virus, in this case, the SARS-CoV-2 virus, the virus that causes COVID-19. And they then treated these cells with ivermectin. And surprisingly or impressively, they found a massive reduction with just a single addition of the ivermectin. They found about a 5,000-fold reduction in viral RNA at 48 hours, and therefore they said, well, this probably means there's benefits for humans. So the next thing to do was, well, let's do what we did for the cells, but let's do it in people. And there was a sort of retrospective study done, which was produced by a company known as called Surgisphere, and they found that compared to conventionally treated patients, they observed a survival benefit for ivermectin. I should say this is sort of a retrospective study. It was rather small, but again, promising evidence. As a result of these early findings, search interest absolutely exploded. This is a graph of Google Trends data. And as well as search interest, research interest intensified, and people all over the world started running small-scale studies or retrospective analyses. And then this takes us to about the December of 2020, where Dr. Pierre Corey, who went on, or maybe at that point had already founded the FLCCC, which is a lobbying group eventually for ivermectin. And he's described to the US Senate, he said, ivermectin has a miraculous effectiveness that obliterates COVID-19. He would later slightly walk back the word miraculous, but certainly at that point the word stuck, and to a lot of people it still sticks. Then, as the studies started trickling in, various groups started putting together meta-analyses, looking at all the studies, pooling the data, seeing what are the takeaways from this data. And one of these studies, one of these meta-analyses was produced by, as I said, Dr. Pierre Curie with the FLCCC, and another one was conducted by people associated with the Bird Group, which is a British, I think it's something like a British ivermectin recommendation development. And you might be able to already see that these both have expressions of concern on them. We'll touch on why that might be a little bit later on, but at the time, those concerns weren't necessarily present. So another person who looked at ivermectin was Dr. Andrew Hill from the University of Liverpool. He also conducted a meta-analysis, and again, he found that there were reasons to be hopeful about it. And he said the purpose of this, in a separate sort of interview with the FT, he said the purpose of this report is to forewarn people that this is coming. Get prepared, get supplies, get ready to approve it. We need to be ready. And it seems like people got ready, because as you can see here, during the pandemic, these prescriptions for ivermectin started rushing up. I think these are prescriptions from pharmacies all over the US, and it shows again during, especially in going into 2021, interest in the drug and prescription of the drug really shot up. Unfortunately, although Merck is an off-patent drug and is relatively cheap to produce, some people took advantage of the hype around it and started selling it via online services, and they would sell it, something that manufactured for pennies, they would sell it for $100 plus. And one of these organizations was America's Frontline Doctors, who were perhaps most famous for including the lady who was dubbed, I think, the demon sperm lady, who believed that endometriosis is caused by sex with demons that takes place in dreams. Another one of the founders of this organization would later go on to be arrested and charged for entering the US Capitol during the January 6th uprising or insurrection, I should say, in 2021. So slightly interesting characters. Again, I don't want to tar ivermectin advocates all with the same brush. This is just to say there are some people who took advantage of this situation. But I've sort of given the positive case. Unfortunately, things slowly started to fall apart a little bit. To begin with, I think it is, a lot of us will have seen this meme. I think it's almost required to be shown at any scientific presentation. And that is that when you see a claim that a common drug or vitamin kills cancer cells in a Petri dish, keep in mind, so does a handgun. That's to say that you can put a lot more of a substance onto cells and kill whatever's in them or even the cells themselves than you could necessarily put into a person without also killing that person. So let's have a look at that original in vitro study, that original sort of Petri dish study. Well, the experimental dose they used was 35 times higher than the standard treatment doses. And already at the time, other scientists started questioning, saying, well, this would be a very high dose. And on top of that, there's also a question of whether you can even get a dose high enough into the bloodstream, because a lot of ivermectin sort of stays bound and doesn't dissolve in the blood. So you'd have to have an even higher dose. And there were lots of reasons to be skeptical, or again, not write it off, but to be skeptical. Then it turned out that Surgisphere study, that initial sort of first study in humans almost, it was retracted because it turned out that the data may have been fraudulent, and there was major concerns with that data. However, some of the remaining studies, there were some left that had already developed at that point. A lot of them tended to be small, and they had often defects with reporting defects. So that's exactly how they did the randomization, all those different things, and were of slightly lower quality. Now, again, not all of them are bad, but there were certainly questions. But there was one exception. There was one really big study, and that was a study out of Egypt by a man. The study was headed by a man by the name of Dr. Ahmed El-Ghazar. And he, I should move to the next slide. He had found in this study that it had massive benefits, like a 90% reduction in mortality. I mean, that would be amazing. It was a large study comparatively. It had 600 patients. They were split into various groups. There was 400 patients in a treatment group and 200 in a prevention group. But the prevention we'll leave aside for now. But he was a prestigious author. He was, I think, the dean of the medical school. He had published a lot of things in Egypt. And this paper, along with these others, but particularly this paper, because it was a bigger study, influenced science policy, and millions were treated as a result, particularly, I think, in South America, but various other places as well. And it certainly was one of the drivers of the, let's say, I was going to say hype, but maybe the support for ivermectin. At this point, I was an undergraduate student. I had done modules in global health. I knew about ivermectin, but I hadn't really been following the scientific debate about its effect for COVID with that much precision. Until one day, I was given an assignment by one of my supervisors, or one of my lecturers. And the assignment was to look at this paper, this Egyptian paper, and write a critical evaluation of it. And it was made clear, I mean, that paper, as I should have mentioned, it was a preprint, but during COVID, which means just it hadn't been published in the journal yet and hadn't been peer-reviewed. But during COVID, preprints really came into their own, and we needed to make decisions quickly. So sometimes we couldn't wait for that sort of peer review process to take place. And there were benefits and downsides of this approach, but I think it was a necessary one given the time and the speed at which we needed answers. So I was asked to look at this paper, and well, unfortunately, I procrastinated, and I read it once, and I thought, it seems interesting, but the language was quite difficult to pass through. And then I started reading it again when I got closer to the deadline, and I realized, okay, the language isn't great, and I thought, well, I'm not going to blame the authors for that. English is probably their second language, and I certainly can't write in a second language fluently or scientifically, so it's fine. But then I noticed some of the sentences were quite good, and there was also something else funny I noticed, and that is that this sentence here, they said this Kelly et al., which was actually that original in vitro study, revealed that ivermectin hindered extreme intense respiratory syndrome coronavirus 2. But then they call that SARS-CoV-2, and I had never heard that term for it. I thought that's a bit strange, so I did Google, and I realized no one else calls COVID that, or SARS-CoV-2 that. It's always severe acute respiratory syndrome, not extreme intense. And then I realized something. The reason for that is because they had plagiarized that sentence from another paper, and they tried to be clever by just running it through a thesaurus and changing a couple words here and there. Not ideal, but it happens. Sometimes it can be difficult to paraphrase things, to put them into your own words. But then I started noticing it happening again and again and again and again and again. This here is almost the entirety of the introductory section of their paper, and everything in red was plagiarized. There's one sentence that they maybe didn't plagiarize. It's hard to say. I couldn't find exactly where that came from. And again, this plagiarism wasn't always copying it and pasting it. It was often, as I said, quite clever, where you'd change a word here and there, but the syntax and the structure and the meaning of the sentence would remain. I say meaning, again, as we see, sometimes the meaning didn't quite stay, but it was quite clear that this text was lifted from places such as Wikipedia and press releases and other papers. Okay, bad. This plagiarism, not good. We don't like it. But we can almost look past it. If the data's good, well, plagiarism happens again. So I thought, well, let me have a look at the data. So they had uploaded their data to a website called filetransfer.io, which I'd never heard of. Okay, I haven't heard of a lot of things. Doesn't mean anything in particular. But when I started, when I wanted to download this data, I couldn't because the link had expired. So I thought, okay, that's that. Can't see the data then. Except I noticed you can pay, I think it was about £10 or £8 to reactivate a link, which is, of course, what I did. Downloaded a copy of the data, but it was locked. Okay, also not great. So, well, what next? Well, I thought, okay, I'm going to just try to guess a couple passwords. What would you go for? Well, ivermectin study, COVID, password 1234, and none of those were the options. So then I thought, well, just before I give up, let me try one more. And the option I ended up going with was 1234. And much to my surprise and shock, the data opened in front of me. And I was able to look at the data. Now, the first thing I noticed with the data, or one of the first things, is that they included the patient initials. And that is very bad practice. That would, in the EU and possibly the UK as well, count as a data breach of confidential patient information. So there might even be a question of, well, why am I even showing you a little screenshot of that data? Well, we'll get to that. We'll get to why I'm not too worried about sharing patient data. The first thing I did is I just got out my calculator. I'm not statistically gifted. I just added up the numbers of deaths they'd reported in their paper for each of the groups, and then the numbers of deaths that they had were present in the raw data. And you'd expect those to match. I think for a lot of other values, let's say heart rate, blood pressure, okay, maybe the values don't match. That's okay. But a death is a pretty binary outcome. Either the patient died or they lived, and you shouldn't really be getting something that basic wrong. So I added up the deaths, and in the summary data, the paper's data, and the raw data, they didn't match. And they mostly didn't match in a way that was always going to make ivermectin look better in their final paper. So, for example, in the mild COVID-19 condition, where the patient was just treated with standard of care, they reported 4 deaths in the paper and 0 in the raw data. Well, if there's 4 deaths in a control, it's always going to make the ivermectin arm look worse, because the ivermectin arm here, they found there was no deaths. Okay. Then what about the next one? Well, the next one was the moderate and severe COVID groups, and the ones who were treated with ivermectin. And here the data revealed there were more deaths, i.e. that they'd hidden deaths in between the data and the paper. Again, not brilliant. And then the third one as well, they got the data wrong. In this case, it's actually a bit of a wash about really if it's doing too much. But nonetheless, the overall picture is that they had so they'd made a mistake that was always going to make ivermectin look better than it actually is, which again is not brilliant. So at this point, I realized I calculated a few averages, those were off, and I was out of my depth. Again, remember, I was just an undergraduate at this point. I was just about to start my master's. This was coursework in preparation for the master's. But so I reached out to some people, and I reached out to actually these people here. This is all their Twitter bios, hence, not Twitter bios, Twitter photos. Oh, look here, just on cue. My cat has arrived, and she's also the one who's in my Twitter bio. She's got perfect timing. Yes, so I reached out to these people, and together we started looking these. So the way I'd found them, I just looked for scientific fraud, ivermectin, people who were interested in scientific fraud, and also people who were interested in ivermectin research. And these were the people I eventually came across. And each of us sort of contributed in our own way discoveries about this data. So I had found that the numbers of deaths were off, and that as the plagiarism. One of the things that Gideon noticed was that there was 4 patients who were all 51 years old. They all suffered from diarrhea. They all had blood, the same blood hemoglobin levels. They were all diagnosed with COVID on the 22nd of May 2020, and they all died on the 29th of May 2020. And they were identical across many other columns of the data as well. And the initials, again, as you can see, were very similar, almost surprisingly similar. In fact, in one case, for 2 of them, they were identical. Then something that Kyle noticed is the terminal digit bias, and that is where you take a group of numbers and you look at just the last digit, for instance, and you strip that out, and then you look at the distribution of those digits. And he found that, to cut long story short, the probability of the number, the distribution of the digits, it's a probability of 2 in 10 billion, i.e., it's very unlikely that data would have been generated in a natural way, or would have occurred by chance, I should say. So then Nick Brown, he had a really sort of good look at it. And as you can see, he found out that basically anything that's highlighted there was either copied or pasted data. Eventually what we found out, or what seems to have been the case, is the authors appear to have copied and pasted a whole bunch of patients and then sort of change a value here and there to, change a 0 to a 0.1 or a 0.5 to a 0.2 or something, just to make it a little bit less clear that it had been plagiarized. Again, had been copy and pasted. Again, I can't for certain say this is fraud, but I would say it certainly points in that direction. Another thing that I noticed is that either the authors had recruited zombies into the trial, or that they were somehow able to communicate by Ouija board, because they had recruited patients into the trial who had actually died by the time the trial had started. Now, that's interesting. It's not great practice, because if the trial had started, which I think it was on the 8th of June, but they'd already recruited patients before that date, well, they could have you can easily, go through and sort of, put patients who died into the trial to make again, ivermectin look better or the control look worse. And I think a lot of those patients were actually in the control group. And also, they couldn't have given informed consent for this study, which had claimed to be a sort of randomized control trial, not some sort of retrospective analysis. So there are all of these problems, and this was I would later find out, quite a major paper in the whole argument for ivermectin. Although some will, of course, disagree with that interpretation. But anyway, I sent out an email to the preprint repository where this paper was hosted on, and they immediately investigated our findings and very quickly published a note to say they'd retracted the preprint, or they're withdrawing it, and they were launching a formal investigation. At this point, we had also been speaking to a journalist from The Guardian in Australia, Melissa Davey, who then went ahead and published an article about our findings and the fact that the paper had been withdrawn. This caused quite a media stir. Again, you must remember, I had come into this as an undergraduate doing an assignment in preparation for my master's degree, and suddenly I was in the BBC, I was in MedPage Today, I was getting a call from a Colombian radio station who wanted to interview me, and I didn't realize they would have to translate what I said. So I spoke for 10 minutes, and suddenly the poor translator had to translate everything I just said. So I later learned to be brief in those sort of places. So how did people react to this finding? Well, Dr. Pierre Corey, who testified to the Senate calling ivermectin a miracle from the FLCCC Alliance, he wrote to the lead author of the paper saying that he thought it was an unfair attack upon him, and that it's how could these people being us do this to us? And the main author of the paper claimed we were against the great Egyptian revolution. Not quite sure which one, but we are against one of them apparently. And that was interesting. So that was his response. He later would admit, actually, the paper stinks, and the FLCCC admitted that our findings had been correct. The other group, Bird, the UK sort of ivermectin promoting group, they said that Dr. Elgazar, the lead author of this paper, hadn't been offered a chance to reply, and that what we had said was defamatory. In the years past, we've never had any request for retraction or defamation lawsuit. And to be clear, I had sent, prior to this it's going live, I'd sent him a detailed email, I think about 3,000 words, to his email, his backup email, and every single one of his co-authors' emails on at least one email, with extensive opportunity to reply, and I never got any. Again, there was also some theory that the manuscript was still under review somewhere. 3 years later, it's never been published. There was one difference, though, and that is, or one person who reacted differently. That was Dr. Andrew Hill, again, from the University of Liverpool. He retracted his meta-analysis, which had found some positive effects for COVID, and he immediately got in touch and started talking about this paper and about other papers. Unfortunately, all our findings were somewhat in vain, because, as you can see here, again, the graph of prescriptions of ivermectin just shot up. And this was, again, we published our initial findings on July 14th. And as you can see here, right after that, ivermectin prescriptions shot up because it had been in the news that it had been building within various alternative health spheres and other spheres that ivermectin is a cure-all miracle drug. So because of this, and because people kept sending us other papers saying, "Oh, have you had a look at this? What do you think of that?" we started what we later termed the spreadsheet of doom. And when I say we, it's myself and the 4 other colleagues we'd done the initial work with this other paper. And we looked at, I would say around 30, maybe slightly more, slightly less, papers that had been published on ivermectin at the time, and we found lots of different problems in very many of them. One of them we called, actually a journalist who we again started speaking to. She called up the hospital where the trial one of the hospitals where the trial had happened, and the hospital claimed to have no knowledge of the trial. One of the co-authors on that paper, again, this is another paper from the Egyptian. On this is a paper in Argentina. The co-authors, he actually asked the main author, "Well, can I see the data? Can I see the raw data?" He was refused. And again, and we found sort of mathematical errors in the paper. Again, this is not to say the paper is necessarily fraudulent, but I think it was quite clear that there was issues with that paper which impacted on its reliability. Another lot of people, we were able to find the raw data, and again, we found that the file contained duplicates of 11 different patients, which had just been duplicated over and over. The authors of that said, "Oh, sorry, that was a mistake. That was training data. It was sent by mistake for analysis. But don't worry, we'll be publishing the real data, and don't worry, the real data found the same effect." I think, again, 2 years later, to my knowledge, that paper or that updated data also isn't out. After looking at all these papers, we found there was a lot of problems. As I've mentioned, patients being duplicated. The patients weren't randomly assigned to different groups. The numbers, they didn't seem likely to occur by chance, or they seemed to be fudged in some way. Percentages all over the place. Local health bodies were unaware of the studies. Some of the studies, the methodology were just weak, where they'd ended the recruitment for the control group and then continued recruiting for the ivermectin group, even though by that point the ivermectin, this was, I should say, a prevention study, even though by that point COVID-19 had had dipped a bit. So there's all these problems from the papers to the methodology. But I should say, in fairness, there were a few positive studies. In fact, some authors even reached out to us to say, "Can you look at our studies and confirm that these are legit?" And there were, positive and negative studies on both sides. But as time went by, better studies started coming along. And I think, again, something that's important to realize is that a lot of people on both sides of the debate really scrutinized these studies in a very, I think, good faith way. And I think a lot of people, not necessarily in the skeptical movement, but sort of who are skeptical of ivermectin, have been too harsh to label people conspiracy theorists and anti-scientific lunatics or something like that, because they've been promoting, or they felt that there might be more to the ivermectin story, that there might be some positive effects. And I think that is important to note, that it's, well, I'll get onto that later. But one person again who did a reanalysis was Dr. Andrew Hill from Liverpool, who had retracted his paper, and he found that when you look at the evidence just with including all these different papers, there's a significant effect for ivermectin. When you remove the studies that are pretty clearly fraudulent, you get a slightly less of an effect. When you remove the studies that have sort of high risk, that were very suspicious or had some suspicious aspects, again, there was even less of an effect. And then finally, when you excluded all of the studies with the problems, the effect for ivermectin went down even further. And overall, there doesn't seem to be an effect for ivermectin. The Cochrane group, who produce meta-analyses on all sorts of different topics and who are often seen as the gold standard, they also produced an analysis, and they found that they're uncertain whether ivermectin prevents death or clinical worsening, or actually, on the other hand, if it increases serious adverse events. And they're still to this day uncertain about that. And I think that is probably where I land as well. That I think, looking at the evidence, I'm uncertain. I think it's anyone who calls ivermectin a miracle drug that's just not credible. But on the other hand, I do think that it's unfair to say there's no reason to think ivermectin might have some effect. So a question that naturally arises out of all of this work is, why do people fake research? Because as we found, some of these papers, the research clearly seemed to be fake. Well, I think the idea that there's malicious or corrupt intent, I think, is very rare. I think most people are fundamentally good, and most people are trying to improve science, improve the world. And they just get a bit carried away because I think, well, I'm just going to fudge this number here. But, ivermectin really works. I believe ivermectin works is what they're thinking. And, I need the world to know. So I'm going to just change this number here, change that number there. And suddenly by the end of it, you've created a data set which bears no connection to reality. There's other people, I think, who are looking for the right answer. There's a lot of times in science, particularly, as you come up through education, GCSEs, A levels, beginning of undergraduate, where you think of science as always having right answers, and that, I just need to find the right answer. And unfortunately, I think schools encourage this, where you'll do a test and there will be a right and a wrong answer. And of course, there are some things which are more right, more heavily evidenced. But I think that there's a danger of thinking, when you're doing an experiment, particularly in an area where there's no evidence or where something's unknown, to think, well, there is a right answer to get to. I think a lot of people look for the right answer rather than the actual answer. Of course, there's some people who fake studies or fudge data for career advancement or for other sort of practical considerations, which aren't necessarily malicious, but are not what we'd say, noble intent. And one person who wasn't involved in the ivermectin papers, but who was exposed a few years ago for faking papers, I think, in psychology, he described it as, I wanted to go faster and better and higher and smarter all the time. I thought it would help if I just took a tiny little shortcut. But then I found myself more and more often in completely the wrong lane. And in the end, I wasn't even on the road at all. And I think that is a danger when we start fudging data, when we start overselling something, that we take a little shortcut, we allow ourselves to make a decision that we're going to do something, and then suddenly we look back a few months, a few decisions later, and we are sort of nowhere near the road. There's no way back without admitting everything that has happened. And I should say, the explanation that a lot of ivermectin research was I wouldn't say just fraudulent, but it was just poorly designed and there's issues, is not the only explanation for why ivermectin seemed to show some effect in early research. There's other suggestions, such as the worm hypothesis, which was created, or at least promoted by Dr. Avi Bitterman, and the idea is that in countries where there are more parasitic worm infections, you see ivermectin having a better effect than in countries without them, and the explanation for that would be that the ivermectin is treating the worm infections, thereby making the COVID patients stronger and better able to fend off the virus. And additionally, there's a second wrinkle on it, that a lot of that people are often given corticosteroids to treat to treat COVID, and the worms, as a response to that, can sort of it can create hyperinfection in the worms. There's also an idea that there was a lot of publication bias going on, and that is the idea that for ivermectin studies, if you had done a sort of small scale, maybe sort of 50, 20 patients, and you had found no effect for ivermectin, you'd be a lot less likely to publish that or to get the data out there than if you had found in that same number of patients a positive effect. And there's some evidence that was actually the case, that ivermectin was the evidence for it was driven by publication bias. So as we near the end, the question is, well, who was right? Is ivermectin a horse drug, or is it a miracle? And I think the answer is, well, it's both. It is not a brilliant drug for treating COVID, but it is let's not use the word miracle, but it is a very effective drug in many other spheres, from particularly antiparasitic infections, or parasitic infections, I should say, and potentially, as I'm looking into, potentially cancer, although again, far too early to say anything about that in humans. But another problem in all of this sphere is that the data for ivermectin was reviewed by the FDA, the European Medicines Agency, the South African Health Department, and lots of other agencies all over the world. I have to give a little bit of kudos to the South African Health Department. When I initially started looking at ivermectin, they were one of the first to really, raise questions about some of the evidence and really breaking down study by study. But on the whole, people didn't. The problems that were raised by these people were not. Well, I should say what they were saying, oh, well, the randomization isn't good. These are small studies, But what they didn't ask is, did this study actually happen? Are we looking at data that is real? Are we looking at patients who are actually treated? Is this genuine? And unfortunately, the answer to that was, well, for a lot of ivermectin studies, or I should say at least some ivermectin studies, that wasn't the case. The data was not natural, was not derived from real patients. So what went wrong? Well, there was these systemic failures by the regulators, by scientists, by sort of whoever you want to blame in the sort of scientific establishment. I think also another thing, scientists and regulators were a little bit slow to act in responding to some of this overhyping, but also not starting studies early enough. I think when there was this potential evidence, there should have been big studies that sort of came out at the beginning of 2021, rather than sort of coming out near the end, half or even into 2022, when by that time the horse had bolted, and based on this initial research where there was some positive evidence, ivermectin had been driven into the spotlight as a wonder drug. And I think, again, there's a big failure in a lot of science and a lot of studies to ask, well, did this study actually happen? And that's, I think, something that we need to more and more start thinking about. I think there was also a lot of politicization that clouded the debate from people like Trump and people on the right saying, well, ivermectin is this brilliant drug, we should all take it. And then that partially initiated a reaction from the other side saying, well, it's a complete rubbish drug, it's a horse dewormer. And I think that meant that one couldn't have a good faith debate. At least it made a good faith debate a lot more difficult. And I think that was potentially harmful for public health. And it also set up the false dichotomies where you either had to say, well, ivermectin's a useless drug or it's a brilliant drug, when, potentially the correct position is, well, it probably doesn't do much, but maybe it does, maybe there's a small effect. And what were the consequences of all of this? Well, again, millions of people, tens of millions, I don't know, but millions of people certainly were treated with the drug or took the drug for prevention. And it might not work. So it might have caused harm in some of those people. And we don't really know, just to full extent, these in some of these cases, really high doses of ivermectin for a prolonged time. And in populations where the drug isn't normally used, it's normally used in sort of sub-Saharan Africa, South America. And what happens if we suddenly start taking it in America or the UK or wherever? Well, we don't know if those populations the drug works as well, or is as safe. Again, more effective treatments missed out on public attention, research attention, financing. And again, going back to the previous slide, there was an unhelpful debate which clouded the science, or distracted from the science. So how can we fix this? How can we fix science? How can we fix all these different issues? Well, I think for me, the biggest is transparency. The only way that we were able to detect a lot of these issues, or one of the major ways, is by actually having access to the data. And I'm surprised that some of these people gave us the data or put up the data because it was so clearly not real. But I mean, good that they did. I'm glad they did. And I think it's important to have that data. And that's why that's something I've, again, fallen into is this work and really trying to push scientific and transparency and integrity. I think it's also important that we start trust. We can trust the data, but we should also verify it. And we should end the assumption of good faith in science. Not completely, but the blind faith that, well, this scientific paper probably happened or as described. And even if there's some, flaws around the edges, at least it happened. I think we need to start thinking, well, did it? And how can we prove that it did or didn't? And again, that's why I think it would be a useful thing to start hiring people not just to look at the stats plan, but look at, did this paper happen? So that's some sort of fraud analyst or fraud investigator. So again, bring this right back full circle, back to 2 years ago when I was sitting at this very desk as an undergraduate student, about to fall into a world and something that I had no idea about. What did I learn since then? Well, I learned that science is broken-ish. There's a lot of brilliant work going on in science, and I'm not saying anything about, we shouldn't discard science, obviously. The audience here knows my work, but I'm saying that we need to think critically about it. But also that collaboration is vital. The people I worked with on all of these things, we were distributed all around the world, different institutions, different places, and we found ourselves through Twitter and through social media. And I think it's very important that whenever that you always collaborate with other people, because you can gain so much from each other's perspectives. Number 3, I think I have to say, we must be skeptical. We must act as skeptics and question assumptions and question the data. And finally, I think one of the biggest things I learned is that anyone can make an impact. If me, as at the time sort of an undergraduate student just about to start my master's, can make global impact, then anyone can. And I think any of you could. So just think critically, think skeptically, and I think together we can help change the world.
Wow, thank you. That was brilliant. That was. I felt like I was watching a murder mystery on the TV, but I didn't know that anyone had actually been murdered until about halfway through. So thank you so much. The other thing that really struck me is you said anyone can do this, but I had lots of images of you in the small hours of the morning, poring over tiny little bits of detail with your eyes going cross-eyed, and I don't think everyone could do that. So, super impressed.
Thank you. Yes, that's true. I at the time I was doing the uni stuff. I was also working a part-time job, and I think for about a good week, 2 weeks, when it initially started blowing up, I think I got about, let's be optimistic, 3-4 hours sleep a night. So that is true. There was certainly a lot of effort being put into it.
And thank you on behalf of everyone for all that then, really. So also thank you everyone for your donations to the Earthquake Relief Fund so far. And as they say on the telly, keep them rolling in. And don't forget to head over to Slido to ask a question or to upvote others. So next month, we have got Kerry Poppy. That's on the 23rd of February. And she'll be talking about mental health pseudoscience on social media. So a super important topic. For now, though, we're going into the break, and we'll see you in 15 minutes. I think that's going to be about 8 o'clock. Yeah, see you then. Welcome back, everyone. I hope you've all refreshed your glasses, emptied your bladders, and are ready to hear Jack go again, really. Because I am. We've got some really interesting questions. Thank you very much, everybody. And thank you again for your donations. Particularly, some people are being really generous. So very, very much thank you. So on to the first question from Paul, aka Picticule, who asks, what do you think is the best way to ensure that studies are carried out and reported properly? Is pre-registration the answer?
Yeah, that's a really good question. I think that is definitely a major component of the solution. I think pre-registration, but not only pre-registration, but pre-registration that's followed up on, that has penalties or some sort of response in place if let me put it this way. So when I was doing, as Claire mentioned at the beginning, there was a lot of work that I did also looking at molnupiravir, which is another Merck drug for COVID. And what we noticed is there was a lot of trials conducted in India on about, I think, 13,000 patients. And those studies, a whole bunch of them happened. They were pre-registered, but nothing was reported. And at one point, that represented about 90% of the global population of patients, the known global population of patients, who had been treated with molnupiravir, again, not by Merck, but by other generic companies who Merck had given a license to. And no one checked, as I said, no one checked what those studies had found, and that, if only 10% of the data on a drug is available, well, we can't say we can't be very confident, or at least there's reason for us to worry. Are we being too confident? I should probably say. And in the US, there's the requirement to upload your data within a year after study completion, but I think from what I last read, about only 40% of papers of researchers actually meet that requirement. And as far as I know, there isn't really a mechanism enforced to actually enforce that, and maybe there should be. So pre-registration, enforcement of that pre-registration, and then also I think another solution is the big one, as I mentioned, is transparency. That not only the summary data, so that's the like 50% of patients got better, needs to be published, but also that individual participant data, obviously following anonymization, following checks to see that it's difficult to de-anonymize, and potentially, for some really private data, behind some sort of restriction, such as, so there's some companies like Vivli who researchers can deposit their data with them, and then when someone wants to request that data, they assess, well, should these people have that data? I think there's a tendency for people to keep that individual participant data a little bit too private, but once it's anonymized, in theory, it shouldn't really be very confidential at all. But anyway, that's rather than me rambling on, I think that's the answer: pre-registration, enforcement, and putting that data public, and then checking that everything along that pathway was done and matches.
So is there anything in place at all for check? Because, people do pre-register, but then does that just go into a void, or is there anything in place?
As far as I know, there isn't really any other than, I guess, public embarrassment. As far as I know, there are no government entities fining people or coming and knocking on their door saying, where's the data? I think it's just a matter of something, public shaming, and sometimes, obviously with ivermectin, there's so much attention on it, but there's millions or hundreds of thousands of drugs and studies into them. And if someone's not really keeping track of what's going on, that sort of stuff can easily fall by the wayside without anyone really noticing.
And worryingly, it probably is.
Absolutely. Yeah. I think it's almost certainly, or not even so, it's definitely happening.
Yeah. So on to the next question, which is from Igor. He said, do you work on something similar to this investigation now? Do you plan to pursue the investigative science career?
Yes, I hope so. I'm planning to start a PhD soon, probably again in sort of pancreatic cancer. Still haven't worked out the final details on that, but yes, I hope to continue doing this. How this whole experience has really enlivened an interest in me about research integrity and about improving science. So it's something I aim to continue with at the moment. Am I working on something at the moment? No, the last big thing was the paper on molnupiravir that I published in January, but I might start looking at what's it called, the Pfizer drug, Paxlovid or something, and seeing if there's something there. But yeah, that's definitely something I plan to continue alongside
preparing for your PhD.
Yes. So one of them is you probably might have to take us like a sideline. I have to sideline it a bit, but we'll see.
Right. Okay. Next question's from Skeptical Gumby, who asks a question probably on behalf of quite a lot of people.
Yes.
And she says, could you explain a bit more about that whole last number thing?
I'm not very mathematically gifted or statistically gifted, so I'm probably the wrong person to really give a good explanation. But I'll try. I'll have a try. So when people are creating or entering data, particularly if let's say made up data, there's a tendency for us to to have those numbers end in specific digits. So we're more, again, this is plugging this number, let's say the 2, we're more likely to end 5.02, and so there will be naturally you would expect some distribution of those numbers. I don't know if you'd expect each number to be present in an equal proportion. I think zeros and some. Anyway, cut long story short, that there's some sort of distribution which you'd expect in randomly generated data. When data is created by humans, i.e. sort of fake data, you expect to see, or a one sign can be, if it's generated sort of manually, is that that's really out of whack. So in this example, the number 3, in like hundreds and hundreds of data points in that study, only 3 of them ended in the number 3, and you wouldn't expect that to happen randomly, as Dr. Sheldrick said. There's sort of a 2 in 10 billion chance that occurred randomly. So hopefully I made that a little bit clearer. If you look up terminal digit bias, I'm sure you can find a much better explanation.
Yeah, so it's sort of related to the fact that we're crap at doing random numbers.
Yes, I think that, yes, exactly.
Yeah. Thanks. Next question is from Serda, and thank you to Serda, who is our Turkish contact, who helped us with the finding the best charities to donate to, or best as best we could anyway. So Serdo asks, do you think that what we experienced with hydroxychloroquine shifted the science community's perception of ivermectin?
I think so. And I think what it also allowed is that there was a whole community that was created on the alternative sort of health, the sort of science skeptic, whatever we want to call the people who, conspiracy theory, whatever term we want to use. It created a community that was primed to take up something like ivermectin. And on the other hand, again, there was, I think, probably, we scientists felt a bit, oh, well, ivermectin is just like hydroxychloroquine, and it's, and I think obviously in some ways it has been, there's been people who have been continuing to promote it in ways that I would say verge on unethical, unprofessional, and just bad. And yeah, yes, unquestionably, I think it played a role.
Sorry, someone's just occurred to me. Why? I mean, did they get money from it?
The people who created the ivermectin studies?
The people who are still wanting to promote it despite...
Yes. So I mean, there's a couple of things that happened. As I mentioned, the America's frontline doctors, whatever they were called, they benefited financially, and they would sell prescriptions, and again, they would sell them, and others as well. I believe it was them who sold. Anyway, some people sold prescriptions for like $149 or something. I think I remember reading for a drug that costs, pennies to produce. Even if you wanted to sell it for the normal price in America, it would probably be under $10 or something for a full course. I mean, don't quote me on exactly, but you can see it. It's like they've added a massive inflation onto that. So the other thing as well is, what was I going to say? That yes, I think some people, there's also a bit of audience capture that they began, I think, fairly, saying, well, there might be something to this, and then the sort of extreme wing said, oh yes, there's definitely something to this. This is, big pharma that's hiding all this data, and then they sort of get dragged along. And for example, the FLCCC, I mean, there were some people who were part of it. I've completely forgotten his name, but there's some people who were part of it who ultimately left because they were disturbed by the way it became anti-vax and became anti-science, and sort of lost that focus on looking for the best treatments and became just sort of a vehicle for ivermectin promotion and ultimately the sort of denigration of vaccines. So yes.
Right. Yeah. That's really interesting, because Not Igor asks a question about Big Pharma. It seems that they can be criticised for promoting drugs and for not promoting drugs. So what Not Igor asks is, how do you deal with all the naysayers who try to claim that your debunking of ivermectin was some Big Pharma plot?
Yeah, that's a good question. I mean, I have never received any money from a vaccine manufacturer, a pharma manufacturer. There's never, like Merck or Pfizer tapping me on the back saying, oh, this ivermectin, we're worried it's going to cut into our profits. And I will, happily go on the record to say that I think, there's the big pharma companies, there's major problems, and particularly, the way that they, price gouged or plan to price, and the IP protection on the drugs, patent, all of that. Like I've got no love for big pharma. I think they obviously fulfill a role in producing medicines, in research, and I'm not saying that nothing they do is good, but I am, I am critical of pharma, and as it, again, if the conspiracy was, which it was at one point, that I'd been paid to promote, to attack ivermectin, so in order that Merck could sell molnupiravir, which is their drug, well, I sort of disproved that by then sort of the next big investigation I did was into molnupiravir. And yeah, I would say with molnupiravir, what I found wasn't fraud. There was other issues with that data, but not necessarily, I'm not saying there's fraud in that. But anyway, to cut a long story short, I think my record backs it up that I'm certainly no lover of big pharma.
So real Igor this time, he says, are the villains of this particular detective story malicious actors doing shady stuff, or just not that brilliant people fudging the data to chase the clout? So
the real question, I think, is who are the villains? And I think some of the villains are, I think it's bad to fake data. I think unquestionably, and I think it's wrong. And obviously they are definitely the villains in that way. But I think, as I said, I don't think on the whole, I don't think they're doing it like with a malicious motive. I think some of it is that they thought there was something really there, and maybe they found in a small study that there was, and then they just parked up the patients to have a bigger sample size, by copying and pasting. Maybe that's what happened. And they did it for reasons of career advancement, because they don't really get money for finding that, but they would be that their paper was massively cited, massively downloaded. They would improve their chances of getting research grants, or improve their chances of being invited to conferences, all sorts of different things. To me, I think the real villains are the people who took advantage of people's fear and sold them a drug at a massively inflated price. I think those are more villainous to me, or I don't know, it's hard to say, maybe equally villainous as the people who faked the data, particularly the people who then never admitted that they'd faked it, or that there were problems. So I don't know. The short answer is I think it's maybe not even for me to say who the villains are, but to me, I don't think most people are doing it for malicious grounds.
So not very clever, some of them.
Maybe I think they're doing it for human grounds. They're sort of very understandable, but bad. Yeah.
So Nadia next, who asks, during your investigative journey, have you received any threats from the villains, for example, to affect your career in a bad way?
Fortunately, I haven't. I think at one point it was difficult for them to even know where my university was. Even my own university, that took them a while to realize I'd actually done all of this. And then I came to them and said, I've been in the BBC and Guardian, and they're like, oh, please tell us more. And then they sort of did a write up of what I'd found. But no is the short answer to my knowledge. But I have had death threats. I have been told I will be on trial in the Nuremberg 2.0 trials. I've committed crimes against humanity. I have been paid off by Big Pharma, and I'm an evil person for what I do, even though, as I said, my position is not that Ivermectin has, that it's impossible for it to have an effect. It's that I just don't think it's likely to have a really useful effect. And the person who has actually received a lot of backlash is Dr. Andrew Hill, who I mentioned a couple of times in the talk. He ended up having to delete his Twitter account because he started getting major death threats for turning on the movement, the pro-Ivermectin movement, they felt. And there's all conspiracies of him being paid off by Bill Gates and all sorts of things. But actually, if you look at it, it was actually a grant to his university, which wasn't connected to him. And it's complete nonsense, obviously. But the conspiracies, they move on, and they, I haven't personally had to delete my social media, but I know he has, and I know some other people have had more worrying threats than I have.
I hope it stays that way for you.
Yes, thank you.
Another one from Igor. He's very active today. Are you afraid that politics are mixing with science to the extent that they shouldn't mix? And do you think that should be addressed somehow?
Yes and no. Yes, I think politics. I think there's a danger of always of politicizing science, and I'm new to this whole area of science. But I've never would have expected like a drug to become an issue that you can sort of fairly reasonably, if someone says, "Oh, I'm pro Ivermectin," you can generally say, "Well, they're probably more on the right side of the." Sorry, if they say pro Ivermectin, they're more on the right, and if they say, "Well, I'm against it," maybe you could say I'm probably on the right. I think that's it's weird, and it's a problem, and I think that it just exposes a bigger problem though in the whole political sphere. I think also the issue is like everything we do is political. Science is political, whether we want it to be or not, or has at least political consequences. And what we fund, the way we, how all these things have political consequences. I think it's unavoidable that politics is involved in some way, but I do think it's a problem when it becomes sort of party political and becomes very violent. The way it's become now. I think it's a real problem.
Yeah. Yes. So Chromium 52 asks actually a really interesting question. Mm-hmm. Do you think the backlash against ivermectin COVID quackery is now getting in the way of legitimate use in studies?
I think it could do. And I mean, again, just as from my cancer example, I mean, I am always at pains. I mean, because it's true that it's, the stuff I'm doing it's far too early to say whether it's actually having any effect, would have any effect in people. But I do also feel that I have to say that a lot more strongly than I would have, a couple of years ago, because I think people immediately jump to, you're a quack as well, because there are, of course, people who, funnily enough, on Twitter, they say, they quietly, released that the fact that ivermectin cures cancer, and then no one's told us about it, and all those sorts of conspiracies. And it's actually, well, no, I mean, you read that in a paper that was published in a journal, and that was peer reviewed, and that, I think it has a potential, but I don't think the danger is as big, because I think people on the more scientific or skeptical side can also see, well, it's not the same situation, and also, yeah, it's. I think slowly, people will readjust and understand that ivermectin does have uses that, are not just COVID or whatever.
The next question comes from Parrot Lady. She says, how common do you think this is? I think by this, I'm guessing that she means the this kind of transferring of data. Can you think of any other topics where you think it's likely to have happened?
It's hard to say. I think the problem is once you become interested in the topic, you start seeing it everywhere, and you start sort of over emphasizing the problem. And there's some paper a couple of years ago that they were saying it's 1 in 5 studies, so sort of 20% of research is fraudulent. Others put that number 1 in 10, 1 in 5. I certainly think it is a problem. I think it's a bigger problem than most people would think it is. And again, it's not because people are doing something maliciously. It's just happening for all these various reasons. So yes, short answer, yes, it is happening. Longer answer, I don't know necessarily what we can do about it other than keep looking. And I don't necessarily, I'm trying to think, I've been so focused on COVID treatments that I haven't really got a good picture of where else it might be. Because also the problem is there's a lot of research in I think anesthesiology, where people have looked skeptically at some of those papers, but the problem is is it just because those people have looked there that they found it? And if you look at some other topic, would you find the same thing? And the answer is probably yes. So I think it's a problem in all of science, but yeah.
That's actually really interesting, because obviously psychology is an area where replication started being really difficult. And as someone who has I'm not a psychologist, but I have a background partly in psychology, and you think, well, hang on a minute, is it just psychology, or is it actually wider than that? And you're suggesting it's probably.
I mean, I think it's also like something like again, maybe I shouldn't speak on this because I'm not a physicist or chemist, but I imagine things like physics and chemistry and some of those more let's say, for want of better word, harder sciences are maybe harder to fake because. I mean, with big discoveries, there's obviously more tension, and the data is like a lot more cut and dry than with humans. Anything with humans gets messy. So I imagine there are some areas of science where it's less prevalent and some where it's more, but I think it probably exists everywhere. Medicine
and psychology are both messy. Yeah. And so talking about, actually, I mentioned replication, but Igor says, is this part of a bigger replication crisis in science? Should we have been doing something already to prevent stuff like it?
Yes and yes. I don't know how much more to say. But I think yes. I think that it's a symptom of a bigger problem and something we should have dealt with.
Right. Garnet then asks, do you think that the Americans being more invested in wanting to believe it's down to... Hang on, let me just try and get this. Do you think that Americans being more invested in wanting to believe it's down to the Trump promotion, or are some groups more susceptible than others? Do you think it's Americans being more invested, or is it just different?
Yeah, that's a good question. I think. Yeah. So let me also. I've got a lot of family who are in South Africa, and it's also a very big thing there. We obviously know about America because we're all sort of hyper focused on America, but I think it was also big in other countries. Now, maybe some of these big political debates were less so, but I certainly think the Trump phenomenon played a big deal. I mean, if we look at the UK, there is a movement there. Some people, there was even some protests about ivermectin a few years ago, or was it a few years ago, in 2021, and the difference here is that it's not easily available as a prescription drug. It's a lot harder to get. You can't, like in America, I get the impression that you can just sort of turn up almost, to a doctor or one of these telemedicine doctors and get prescribed it, just because you want it. Here, we've got different norms about it, and I think that played a role in the fact that it didn't really become as big an issue in the UK. So again, yes, short answer is having I think the Trump phenomenon played an effect, but I think there's a danger of just viewing it as only the Trump phenomenon because it did happen in other places.
Yeah. So yeah, don't be complacent.
Yeah.
There's just a couple of questions left. So you were telling us that your university had no idea that you'd become famous.
Yes.
But what about your supervisor? Did the person who sent you the assignment paper know it was such a can of parasitic worms? And were surprised?
No, they had there was two of them, but no, they hadn't. But neither of them had any idea. That it was really an assignment to test again. How are we approaching papers, and also understanding. A preprint is less. Hasn't been peer reviewed yet, so it's maybe less. We can put less trust in it than paper, and it was all those sort of skills. How do we, as budding scientists, start evaluating that stuff? So. When I brought it to their attention, they were both shocked, and they said, "Oh well," I said, "Can I mention that I found this stuff?" And they were like, "Well, you can. But it's not really what we were, the skill that we're trying to test. So only mention if it's relevant." And in the end, we were asked to critically analyze the paper, and you would have thought that by getting the paper retracted, that would be sort of the ultimate example of critical analysis, but and be worthy of 100%. Unfortunately, in the end, it wasn't. I think I got 72%, which I guess is a first, but I don't know. I feel like I want them to recount the votes.
You want a prize? You want some special prize for look what I did? I want
Exactly.
that. So the last question, and she may be asleep, but is your kitty available for just to say hello again?
Yes, she it's quite funny. While I was talking, she walked past at one point, and then she opened a sock drawer and climbed into it. So I'll just see if she's awake and if she feels like being on camera.
Thank you.
Here we go. Ooh.
What's her name?
Tiggy. T-I.
Hello, famous cat. Famous Twitter cat. Thank you. I can't see the thing at the moment, but I know it'll be going absolutely wild. It did last time she made an appearance. So I will just say thank you. Thank you for keeping it absolutely riveted all evening. And I think a lot of other people were equally riveted, and we'll be keeping an eye on what's happening in
Yes.
So just to finish up, we have had, you've been great with your donations. We've topped £800. That is a lot, and that will be going to Turkey and to Syria. And don't forget, in 2 weeks' time, we have got Carrie Poppy talking about mental health pseudoscience on social media. So to finish up, another brilliant round of applause, please, for Jack Lawrence. Thank you.
Thank you very much.